Okay, today I'm going to go over your newborn assessment with you. As you can see, I have a baby that was probably a baby of a gestational diabetic, considering the size of him. This baby would be at risk for shoulder dystocia as well. But this little guy is the closest I had to a newborn that was quickly accessible. So when you first go in to assess your baby, first things you should do are the most non-invasive stuff, and then move to the most invasive. Because obviously the more invasive you are, you can change their heart rate, you can change their respirations, as well as when you undress them, their temperature can then be changed as well. So some of the things that we could do first is we could look at his appearance. What is his behavior type? Is he quiet? Is he quiet alert? Is he sleeping? Is he crying, irritable? What is it? And then we can look at his position. Is he flexed, which we know that's a normal newborn position? Is he flaccid? Is he limp? We don't want our babies to be limp for sure. So then we can actually assess that with just appearance. Additionally, we can look for any signs of respiratory distress. We can look around for some circle aurum cyanosis. We can look for any flaring of their nostrils. We can look for signs of grunting. And grunting doesn't always sound like a deep grunt that you would think. Grunting sometimes in a baby sounds just like, when you're doing that. And sometimes moms will say, the baby has been talking or really vocal today. And that should alert you that newborns should not be that vocal when they're first born. So he is kind of rooting. He is, so that's one of the reflexes we'll go over. But they should not be talking at that point. That would be a sign of respiratory distress. Additionally, with respiratory distress, I can observe his abdomen and his, I can look at his chest. If they are having retractions, you will see an upside down V right here, sucking in, right there. And then we might also be able to count his respirations while he is quiet, okay? Remember, babies are belly breathers, and they also have a regularly irregular, oh, you're ready, oh, you're all right. Regularly irregular respiratory pattern, and that is due to an immature neuromuscular system. So basically, when we are checking his respirations, we do not anticipate that they will be regular, and he may absolutely have normal periods of apnea as well, okay? So I get his other vital signs, save that temperature for the last because it tends to get them riled up. Additionally, with that being said, you want to take their temperature before you undress them and do all the other assessment, because they could end up losing temperature. Listen. Okay, we're going to assess your head. We are going to assess your head. Yes, we are. When we're assessing your head, we're making sure that you are... Hey, do you need some sucrose? Yes. Yes. When we're assessing his head, we're looking to see what the shape is. We are looking to see babies' heads when they're born are not, their sutures are not closed. So they have sutures, they're not molded. I know you're falling asleep. So I'm going to check his suture lines that run right here, down here, and straight back. And I'm gonna see, are they approximated? Are they overriding to get through the birth canal to make the head smaller? Or are they split, which that means I can run a finger all the way through. Sorry guys, this is on a pediatric unit right now and kids are screaming. I'm sorry. So with that being said, I look at his head. I also am gonna check his anterior fontanelle. Yes, I am. His anterior fontanelle is right here. And remember, babies wear their diamonds on the front, and that's where those sutures come together. That usually closes fully at 18 months, so I can actually still palpate his because he's only 10 months. And then they have a posterior fontanelle back here that's triangular, and that does close sooner, and I cannot palpate that. Then as we're moving down, we're making sure his eyes meet up with his ears, and they are not, your ears do not appear low. I'm checking for ear recoil. Very good ear recoil. You are a mature baby. Slow ear recoil. So it's slowly, you stick it there, and then you have to go, oh, wait a minute, go back here. Could be a gestational age assessment finding of a premature baby. Your eyes have no discharge, so that's wonderful. And let me check your nose. Oh, his nares appear patent. Babies are belly breathers, but they are also nose breathers. So I always tell moms, don't go boogie hunting. Oh, and you were born with teeth. That's wonderful. So I tell them not to go boogie hunting with a syringe because you do not want inflammation in there, because that can further obstruct their breathing. Oh, and you can take your passy out. Yep, that's great. Now, I'm not brave enough to stick my finger in his mouth because he may chomp down, but I would want to take a gloved finger, and I would want to stick it in his mouth, so that way I can assess his suck. I can feel his palate. Yes, I can. And then I can feel along his gum lines to ensure that he does not have any insidious teeth. And sometimes babies are born with teeth, okay? Your chompers look real. I am noticing that he actually has several marks on him. When he was actually born, guys, he only had 3. And I know in one of your quizzes for clinical, we reviewed the quiz. Ricky, turn that off. We reviewed that with the cafe au lait spots, that 6 or more could be indicative of a pathologic condition. So the same kind of thinking goes with hemangiomas. And he's got several hemangiomas. So what we would do is we'd want to chart those, the location, the size, and how many there are when we are doing his assessment, so that we can monitor them. So he had 3 when he was born, and I think he has probably close to 10 to 13 now. He does not have a pathologic condition. They just said that they will grow, they will, and then the blood will constrict in them and they will go away. Yes, they will. Yes, they will. Oh, I'm doing one of your reflexes called the step reflex. Is when you hold your baby gently like this, and when you hit their foot down, the other one goes up almost like in a stepping motion. Okay? Then I am going to look at your extremities. I see that you are moving every extremity evenly. Yes, you are. Yes, you are. And I am looking, since you were gestational diabetic and you look super cute. Yes, you do. I'm going to check your clavicles. Oh, yes. I feel no click up in that region. I'm checking your palmar reflex, where he still has it, and holding my hands. Here, get over here, you little stinkers. Oh, I'm checking his plantar reflex, and then I'm checking his Babinski, which you see how his toes aren't going like this, but they're going up versus curling over. Listen. His neck looks midline. His breasts should have little breast nodules in them, usually 3 to 10 millimeters. That's perfectly normal. His don't have them anymore because his have, yes. That's usually from maternal hormones, okay? Oh yeah, let's look at your abdomen. I will listen to your abdomen. Sorry, we got to get listen, I'm telling you what, breast babies don't play. And he is a breast baby. Okay, so I'm looking at your abdomen. It does not appear distended. It's soft, it's flat. I'll listen to his lungs. They sound clear. Sometimes they sound wet right after birth, but that should clear with time. Some of it will absorb, some of it they gag up. Your heart sounds perfect. I did not hear a murmur. You want to hear their S1, S2. And then your umbilicus, your cord already fell off. This is fantastic. And then his extremities, his legs are the same length. And then I'm going to look at you. Better not have a surprise in here. Yes, you're not. You don't have to feel pulses on a baby unless that is indicated, okay? But when I'm looking down here, what I'm looking for is you can look for their gestational age based on genitalia. For a little boy, it will be if they have rugae on their scrotal sac, and he does have rugae, I see that. And then sorry, I'm just feeling your testes. I am just palpating his testes and trying not to get a surprise. So for a little boy, you want, and he's been circumcised, so you want to check for their testes, you want to check their scrotal sac to see if it has rugae. A premature baby on a gestational age assessment would have a more smooth scrotal sac than a baby of term or post dates gestation, okay? Yeah, let me see your bottom. Let me see your bottom. Now, there are parts of your assessment that you guys are gonna do on your, that you're gonna be tested over is variances on their head, okay? So some variances on their head that you may notice are if they had a long time delivering, they might have an area of swelling right up in here. We call that caput succedaneum, okay? Or just caput. And that is just a real jiggly, superficial swelling that we would note right here, okay? How we know that it's caput versus a cephalohematoma, which is another thing I'll talk about, is that it crosses the central suture line, okay? It's right here. Kind of feels like a Shar-Pei puppy when you can kind of jiggle it around a little bit. It's mostly fluid and a little bit of blood. So you can either think a cap is a hat that you put on your head, and when you put a hat on your head, that crosses your central suture line. Or you could think caput succedaneum crosses suture CS, okay? Just something for you to remember for your test. The other thing that you might note, variances on his head, would be a cephalohematoma. And this, you would notice that it is a cephalohematoma. Oh, you just dropped your Bessie, yes. Based on the fact that it's on his right, it's okay. Oh, you're angry. No, if it dropped on the hospital floor, we would not want to pick it back up and stick it back in his mouth. And I know, I have nothing that you want. I am so sorry. I'm so sorry. Oh, that's okay. It's okay. But cephalohematoma, cephalo meaning head, hematoma meaning, bruise or blood. And that is on the right or left. And that's how we will indicate that. That is mostly blood and some fluid. And what I can say is swelling, which is mostly caput. Swelling occurs very quickly, where a bruise happens a little later. So therefore, caput happens more quickly and resolves more quickly. And a cephalohematoma evolves slower, just like a bruise, and then takes a little bit longer to absorb back and heal, okay? Last thing we're gonna check for is, yes, before you get moving on me, is our back. His spine looks intact. It's okay. He has no sacral dimple, which I'm looking for. Oh, and then when I look at his hips, they are equal, okay? Oh my goodness. Okay, you can see your mama. You need to breastfeed. Yes, you do. So that is the gist of a newborn assessment, okay? Here, give me your phone. You can take this baby. That's the gist of a newborn assessment, and he is angry. So there are going to be variances that you may find with their skin color, skin type, and variances on their skin. Newborn rash is one of them, which would be called erythema toxicum. And that is red splotches with a white center to them. And that is just a rash that can come and go, and you don't need to do a single thing for it. We would also want to describe their skin as intact, dry, peeling, based on, sorry, it's loud, based on what we are noting and certainly any input or output that we have seen during our assessment. So I didn't go over all of the reflexes, but I would review those for your exam. But during your thing, you can check on them. And I went over some of them. And that was the palmar grasp, the plantar grasp, the Babinski. I talked about the rooting reflex, talked about the sucking reflex. Along with the sucking, you're looking for sucking, swallowing, and gag. I wasn't brave enough to stick my finger in his mouth, so I'm sorry. And this stepping reflex I showed you. Now, one reflex I could not show you on him was called the Moro reflex or the startle reflex. And what you would do for that baby, here, come take this. I'll try and see if Bowen will let you. Now we're really moving, huh? Now we're moving into pediatrics for sure. Okay, come here. This is my baby. Yes, it is. Yes, it is. So starter reflex is when you pull their arms straight. You don't pull them off of the bed because you don't want to drop a baby. You pull them and then you let go. And they should go out and then know to come back in. Usually their index and their thumb make like a C pattern, okay? So that is a really good indicator that their neurological system is intact. So, and then I think that is all that you have for your newborn assessment. If I'm missing anything, I apologize. I did the best I could with what I had available. So if you have any questions, let me know. Thanks. Ready?